Here we go.
Good. Good morning, or good afternoon, wherever you are. Welcome to this webinar on measuring state flex program impact, tools to support outcome measurement and evaluation. This was developed as part of our work on the flex monitoring team, with the support of the Federal Office of Rural Health Policy. Before we jump into our discussion, we'll do a brief introduction of our two panelists today. My name is John Gale. I'm a senior research associate and a co-PI of the Flex monitoring team. Bridget?
Hi, everyone. I'm Bridget Haar. I'm a policy associate and a member of the Flex monitoring team.
Thank you, Bridget. I'll go briefly over our agenda today. We're going to talk about the toolkit, why we've put it together, and how you as a state flex coordinator or a member of your state flex program can use the toolkit to implement a funding cycle approach. We'll apply a framework which many of you may be familiar with, the Plan, Do, Study, Act PDSA framework to state flex program projects, and then discuss how to use the toolkit and worksheets to develop and manage a cohort-based quality improvement project. So, an important part to think about as you plan your flex program activities is the federal office has strongly encouraged taking a funding cycle approach. And by this, we mean looking at your program over 5 years of funding and moving step by step to target problems that are being experienced by your critical access hospitals, any RHCs that they may own, emergency medical services. So we really want to focus on how to do that and move from step to step, which will give you an opportunity to look at the big picture and make mid-course adjustments as necessary. So year one is project implementation. You're starting the foundation and establishing the foundation for subsequent years. You're focusing on assessment, refinement of the projects, identification of the participants, capacity building, project implementation, development of a measurement strategy with baseline data, outputs to assess implementation, and a chain of outcomes. This is really a foundational year because in the first year of the funding cycle, this is really what puts it all together. You need to know that the project you've developed is being implemented as intended. It adheres to any of the evidence on which it's based. And then subsequent years, this is really where you get into managing, monitoring, and revising projects. So you're looking at focusing on the sequential steps in project activities that build from one year to the next. So at the end of each project year, State Flex program should be able to use outcome data to assess the progress against plans and baseline data and adjust project activities, timelines, and expectations accordingly. As we all know, best laid plans of mice and men soon go astray. And so it is very important to be able to adjust and adapt to the changing environment in which your hospitals, clinics, and EMS agencies are operating. The perfect example, which many of you will remember, is the COVID-19 pandemic, which made it very difficult to adopt the plans or implement the plans, I should say, that most states had developed, and they were really forced to adjust on a mid-course basis. Finally, I want to look at the monitoring management evaluation across the project lifestyle. This is a graphic of the PDSA cycle adapted to organizational performance. So you start with assessing the target population. Who are you trying to target? What are their needs and plans? What are you trying to accomplish? What are the activities and project steps? What data is needed? You also need to understand if the target population, your CAHs or CH-based RHCs, are interested and willing to sign on board. It is not unusual for states to have to rethink projects as they get implemented. Some hospitals and clinics may continue, others may not. So you really need to be focus on what is it they think will be helpful. The do is the implementation stage. Everything's been implemented as planned. You're monitoring implementation outcomes and challenges, and you're documenting and reporting what happened. Study is towards the end of each project year and the end of the funding cycle. Is the project successful? How do you know? What analyses do you need to conduct? How do you compare outcomes to proposed benchmarks and goals? And then summarizing the conclusions. And finally, as you study, particularly in the intervening years from years 3 through 5, how did the project impact the target population? What, if any, changes are needed in the next cycle and what happens next? And this is just a circular activity that will go around, and you'll do this over the course of the funding cycle and within each funding year. I'm going to turn this slide over to Bridget. Bridget, would you take this one away?
Yeah, absolutely. So the next portion of the presentation is going to be focused on presenting each of a series of worksheets that are included in the toolkit that help you go through this outcome measurement or outcome planning and measurement process. So the first worksheet, when we start with worksheet 1, we're really laying the foundation for everything that comes next. This worksheet is where you create a project map, a roadmap that ties together your project activities, resources, outputs, and outcomes, leading toward your overall impact goal. In practical terms, worksheet 1 helps you answer, what problem are we trying to solve? What is our long-term aim or objective? And what series of steps will get us there? As John often says, you might think of it like planning a road trip. You first choose your destination. That's your impact goal. Then you decide on the route and the mode of travel. That's your project strategy and set of activities. And just as you check your roadmap along the way, the project map lets you track whether you're moving in the right direction and where adjustments may be needed. This worksheet also introduces the concept of if-then logic. For example, if we hold a quality improvement meeting with critical access hospitals, then staff will increase their knowledge. If staff increase their knowledge, then they're more likely to implement improvement processes. Step by step, those changes build toward your larger impact goal. Once you've laid out the project map, worksheet 2 asks you to pause for a reality check. It focuses on testing your assumptions and accounting for external factors that could influence success. An assumption is essentially your reasoning for why you think a chosen strategy will work. For example, you might assume that improving communication around patient transfers will reduce errors. That seems logical, but worksheet 2 asks you to check, how do you know this is true, and what evidence or experience backs it up? External factors are those conditions outside your control, like staffing shortages, changes in reimbursement, or limits in electronic health record systems. Identifying them early helps you decide whether adjustments are needed or if you should build in contingency plans. So together, worksheets 1 and 2 provide you with your project's map, context, and potential constraints. They clarify what you're aiming for, how you expect to get there, and what might help or hinder your path. Next slide, please. With worksheets 1 and 2 in place, worksheet 3 moves you into identifying the actual outcomes you expect to see from your project. This worksheet uses the SMART test to make sure your proposed outcomes are specific, measurable, attainable, results-oriented, and timed. Each outcome should pass this test to be included. For example, a sample outcome might be, following participation in a cohort project, the percentage of critical access hospitals implementing new strategies will increase from 35% to 50% within 1 year. That's SMART. It's specific, measurable, and sets a clear timeframe. The key here is sequencing outcomes logically. Short-term outcomes like changes in knowledge lead to intermediate outcomes like changes in behavior or performance, which lead to the long-term outcomes like improved patient health. If worksheets 1 and 2 gave us the map and context, worksheet 3 is where we check whether each stop along the way is both realistic and worthwhile. Next slide, please. Worksheet 4 helps you turn proposed outcomes into clear, precise outcome statements. These statements identify and explain who or what will change, in what way, by when, and how we'll know the change occurred. For example, an outcome statement might read, following a critical access hospital training, staff will report improved knowledge of transfer communication techniques within 3 months. These statements are then used to guide your data collection and reporting later on. They're also quite useful when explaining your project to stakeholders or funders. A well-written outcome statement makes it crystal clear what success looks like. You might think of them as your project's elevator pitch. If someone asks, "So what's this project supposed to accomplish?" this is the language you'd use to answer. Next slide. Next, we're going to shift focus from what we want to achieve to how we'll know if we've achieved it. Worksheet 5 is all about identifying outcome measures. Good measures should be direct. They should actually and accurately capture the change you care about. They should be specific so that they can be consistently tracked. They should also be practical so you can reasonably and realistically collect the necessary data with attention to limits related to time and cost. And finally, outcome measures should be comprehensive so they capture and reflect both positive and negative effects. Worksheet 5 helps you pair each outcome statement with one or more measures that will allow you to demonstrate progress in concrete terms, while noting which data source will be used for each measure. Next slide. By the time you reach Worksheet 6, you've built the pieces of the project map: activities, outcomes, and measures. This worksheet asks you to pause and take a step back to look at the project as a whole. Here you're checking whether the chain of outcomes makes sense. Do the short-term outcomes logically lead to the intermediate outcomes? Do the intermediate outcomes point toward the long-term impact goal? Are the activities and resources sufficient to achieve them? It also asks whether the outcomes are meaningful, feasible, and applicable to participants' real needs. For example, you might consider whether hospital and clinic staff will see a proposed outcome as a practical solution worth their time and effort. Worksheet 6 acts as a final filter, like zooming out on your roadmap and asking, does this route really get us to where we want to go? And if not, what needs adjusting before we hit the road? Next slide. Finally, we arrive at project management. Worksheets 7A and 7B adapt the Plan, Do, Study, Act cycle, which John introduced earlier, a continuous quality improvement framework you may already be familiar with, to help manage and evaluate project performance. The idea here is simple. Projects rarely unfold exactly as planned, and PDSA cycles provide a structured way to monitor progress, identify challenges, and make mid-course corrections. Worksheet 7A helps you track implementation activities, what was done, who participated, and whether the project unfolded as planned. Worksheet 7B helps you evaluate project outcomes, using the measures you identified earlier to see if the intended and expected changes occurred. Together, they provide a built-in mechanism for reflection and adjustment. They also align with Flex program reporting needs, making it easier to prepare annual progress and final reports. Next slide. Beyond simply monitoring performance, Worksheets 7A and 7B also reinforce a continuous quality improvement mindset. They encourage project teams to regularly ask, what's working well, what isn't, and what do we need to adjust moving forward? This is about keeping projects flexible and adaptive, rather than static and unchanging. By making ongoing evaluation part of the process, state flex programs can catch problems early, adapt strategies, and strengthen projects over time. You can think of these last worksheets as your project's dashboard. They don't just tell you if you've arrived at your destination. They show you how the trip is going, when you need to refuel, and whether you need to adjust your pace or change course to get there. Taken together, worksheets 1 through 7 provide a structured process for planning, implementing, and managing flex projects from start to finish. They help create a roadmap and a dashboard, allowing you to chart your course, check your pace, and make adjustments along the way. With that foundation in place, I'll turn things back to John, who will walk us through a concrete example of how these tools come to life in a sample project.
Thank you, Bridget. So as we mentioned in the introduction, we're going to talk today and use the worksheets to build an example of a cohort-based emergency department transfer communication improvement project. And before jumping into the worksheets, I want to reinforce a few key points that Bridget had made. We often see among FlexGrain applications either a tendency to use output measures, which are the things you can count, or very high-level impact measures without thinking about the steps along the way. And this is where the analogy of the map makes such good sense. You don't start you start planning to reach your destination if you're taking a road trip by looking at the interim steps. Where are you going? What are the major signposts, waypoints that you need to be aware of, and then moving along the way. So it's really important, I think, to look at the project as a whole, understand what foundational activities may or may not be present before jumping into the larger outcome goals. This way you can build momentum and build progress over time. Oftentimes, the impact goals may be at a significantly high level that it's hard to prove you've really gotten there. But if you're moving in the right direction, so for example, with if you're trying to improve the financial stability of your hospitals. Stepping along the way, are you capturing all the charges? Is the hospital capturing all the charges it's supposed to? Are they coding it correctly? Are they submitting the claims properly? Are they able to collect in a reasonable time frame? If not, how do they correct that? Then making sure that you're building in the services, are you developing a service mix that the community needs and will use? And that eventually adding up to that, you may not be able to prove at the end of the day that your hospital is improving and better off as a result of the high level measures because there's so much else going on in the environment. But you're showing that you're moving in the right direction. So you're collecting all the cash you can, or you're building services people need. And you're getting to the point where it at least have an impact on some of the measures you select. So we're going to jump into the first worksheet, which is the sample project map, improving EDTC scores. I'm not going to go into each of these different pieces, but if you look at the form, these are sort of where you begin to provide the context for what you're doing. What's your goal? In this case, it's reducing the errors related to patient transfers by improving scores on the EDTC measures. What is the problem statement, at least among the hospitals you work with? What is their rate of medical errors? Are they, when they're transferred from your emergency, CH emergency department to another level of care? Um, we know that these transfers require a high level of coordination, and it doesn't always happen. Then your theory of change. This is sort of the sort of elevator speech, for lack of a better way of phrasing it. How are you developing a performance improvement cohort, which is focusing on the improving EDTC scores and the quality of care provided? So you walk through all the different steps. Let's also look at the assumptions because those assumptions can be a problem. Do we know that your CAHs and receiving providers recognize the importance of improving the transfer of clinical information? Is it something that they find important? Is it a sufficiently high priority for them to invest their limited time and resources into improving that measure versus something else? So this requires a conversation in advance of developing a project. And some of the external factors, how well do the EHRs, electronic health records, communicate between hospitals in a community and receiving patient care providers? So also high rates of staff turnover may reduce participation in the cohort. These are things to be aware of. Sample project map lays out the steps. Um, and I will go over it at a fairly high level. The top bar are just the basic categories. The next line down talks what you're trying to do within each of those. So let's start with improving CH performance on the EDTC measures. First off, if you're building a cohort, which is a very effective way to use resources under the state flex programs. You're convening a meeting of CHs to review the measures and to learn techniques to improve the transfer of information between their hospital and the referral providers. So we've broken down some of the resources, a little bit of the flex coordinators time. Are you bringing in subject matter experts? There's a cost, there's meeting space and supplies. And then the next measures are really the next measure is really the outputs. You're counting whether or not people from the CHs and staff from the CHs participated in the meeting? Did they report improved knowledge? And this is where it starts to transition into an outcome. That improved knowledge is associated with changes in behavior and a greater willingness to adopt these measures. Then next step is you're developing the project and implementing it over time. You're looking at the flex coordinator's time, travel if these meetings are on site or in a central location, meeting space and supplies, and for the number of meetings you'll hold. So the goal we found, at least within cohorts, is having them meet regularly to share their best practices, their successes, and even some of the data if they're willing to do that. So again, you look at participation in the meetings and satisfaction, and then you move into the extent to which they're implementing strategies. So in this case, we're looking in the short term, which is that first year of the funding project. Are they improving? Are they implementing strategies to improve EDTC performance from 35 to 50% of the CAHs in the cohort? Looking at the intermediate outcomes, you're looking at the extent to which they are showing improvement on the different measures, including the all or none composite calculation. So improving from 50% to 75. And finally, the higher and long-term outcomes. Are they experiencing fewer communication errors? Increasing that to 75% who are experiencing fewer communication errors. Are they experiencing reductions in preventable hospital readmissions and ED use? So that'll increase by to 75% of the participants. So these are all, I think you can see this is how you begin to work across these projects in a stepwise fashion. This goes to worksheet 2, which is where you are testing your assumptions. So what are they? Do the staff recognize the importance of providing accurate patient transfer information? Are the electronic health records set up to do that easily? Or are they having to default to paper back and forth, which is an incredibly inefficient use of resources? And are the hospitals willing to participate in this project? Do they have other priorities that they feel are more important? And so I think these are things to test. You have to really sit down with the hospitals and others to do this. Then finally, what are the external factors? We know that some CHs are part of large systems that are reluctant to participate in state flex program quality improvement initiatives. And are CHs willing to share patient quality data with the state flex program? All of these are helpful to know and to monitor. And this requires some work with system-owned CHs and beginning to implement a process to protect the confidentiality of their data. It's fine to share it among each other, but how is there a way to make sure that doesn't get out beyond the cohort? So this is all part of that process. Excuse me. Then now is assessing our outcome measures, improving the EDTC scores, and this is where we jump into and use these smart tests that Bridget, excuse me, I'm sorry, it's one of those days. Bridget had discussed earlier. So following the meeting of CHs, are they showing improved knowledge and willingness to adapt and adopt efforts to improve patient transfer communication? Once they've been part of the concept, the cohort-based meetings, are they willing to implement? And how many of them are doing so? What is their performance, at least in moving from where they were to where they are at the end of that first year? Next step is they start to show improvement on select measures. Moving from 50% to 75% of those hospitals are showing improvements on those measures. And then finally, towards the latter part of the project, are they seeing fewer errors that you can document? Are they able to reduce the number of preventable hospital readmissions and ED use among patients transferred by CHs? And that goes up by 70% of the hospitals, showing that sort of benefit. Writing the outcome statements. And here I would suggest this clarity is incredibly important so that everyone knows they're measuring the same thing. And at the same time, I should suggest it's important to pick a select number. Please don't overdo the outcome measures. You don't need a huge number of measures for most projects. Rather, you need the ones that are most appropriate to showing change in the time period in which you're focused. So, um, each of these will break this down in a way that makes sense. So, for example, the staff are participating CAHs. You're looking at the number and percent of CAH staff that are implementing strategies to improve EDTC performance. This is something that they will have to report to you. You're looking at improvement for the next stage on all measures of the EDTC process. Now, some of these, depending on the time frame, may be captured by MBQuip that you're all familiar with, but you may have to ask them in the short run to document their performance. So again, each of these are stepwise. Make sure it's clear, it's easy to follow, there's no ambiguity, and finally, you know what data sources that are going to be used to populate these measures. And then let's look at identifying and assessing the measures. Are these the right ones? Now, we walked through and identified some of these. Are they direct? Are they specific? Are they practical and comprehensive? And do you have a data source that can be used to collect them? So in each of these, so for the first, improve knowledge, you should do pre-post survey for educational activities. Increase in implementing strategies. That'll be self-reported by the CAHs. Implementing, showing improvement in other measures. That's an MBQuip or report on the EDTC measures. And then finally, the fewer communication errors and reductions in patient unnecessary preventable admissions or ED use. That's going to be a combination of MBQuip and hybrid hospital-wide readmission rates. 6, we're getting into where we assess the project as a whole. This is important, and this is probably something to do during the planning stage with your hospitals and stakeholders. So, meaningfulness, is it relevant to the needs of potential participants? I'm sure we can all come up with ideas, but do they resonate with the hospitals at a given moment? Do they provide a significant benefit? And have you looked at any potentially adverse outcomes? We all have, every project has them. Are there relationships between the activities? Are they causally related? Do we expect if we do A, it leads to B, B leads to C? So in this case, improving knowledge leads to greater implementation, leads to better outcomes on the metrics. Are they feasible? Is this something you can do within the timeframes established? Is it something that hospitals have the room in their portfolio of activities to do? Have you identified the assumptions and are the assumptions valid? And finally, how applicable is it? Are the outcomes clear, specific enough, and complete to be able to, for your hospital to be able to use to make a difference and make changes in how they perform related to the EDTC measures? And this is the last page, and the last two worksheets that we'll go through. And this is where I think this toolkit can be incredibly helpful to you. You've done a process of really laying out a very practical, achievable project. You can then use that to build your work plans or make necessary adjustments. But here is at the end of the day, as you begin to collect and look at these, where you are and what you've accomplished within the course of a funding year or across the cycle. And you can use these reports, these two worksheets, to begin to build your annual project progressive reports that you submit at the end of each funding year and then at the end of the funding cycle for your overall progress. And this can be really helpful. So you're describing the activities conducted during the project year. Things, did you implement those activities, the education, the peer group meetings, the webinars? Um, Then describing the target population. Who are you targeting? Did they all stay with the project or did some drop out? There are good reasons why they might, some of which involves turnover among staff. So if you targeted 15 hospitals and 8 remained involved, that gives you the important pieces of information. And the total program participants who attended at least one session or individual project. Not all projects during the year are active during the project year, so it's really when it was offered, the number of participants. So in this case, it was CAH staff. If participation fell below expectations, please look at why. This may be good reasons and maybe things you can moderate, maybe not, but you need to know. Get feedback from participants, report any changes as a result of the work during that project year, and what, if any, changes would be necessary to improve satisfaction or the effectiveness of the activities. So this really takes a little bit of time to work through and takes some thinking, but it really helps you to develop a much more effective evaluation statement of how successful your activities have been. And then finally, we'll look at really the step-by-step review, how it happened and what changes might be. Did the project achieve the outcomes anticipated funding cycle? If yes, why? So the short-term outcome target for this first line was moving from 35 to 50% of participating CAHs. So in this case, the Flex program fell short at 45%. Two had trouble with their EHR. So what might you do? Conduct more meetings using virtual technology. It makes it easier for participants to engage rather than travel, providing direct support to those who experience trouble with their EHRs. And help them to prepare. And this is this idea of building that foundation. If their EHR isn't helpful, then it's going to be a lot harder to improve the EDTC scores because communication is difficult. If you're going to change the goals, why? Are you targeting a different condition or behavior to adjust the outcome goals up or down or repeat a current phase of the project? Again, this feeds into your progress reports. Is it necessary to revise the project significantly? In this case, no significant changes are needed. Maybe perhaps a little more attention to those cohort members who are struggling with their EHRs. Are additional resources needed? Do either the state flex coordinators or the subject matter experts have the capacity to work with hospitals that are struggling with their EHRs? This is a particular skill set. Do you need additional subject matter support to provide that remedial support? How well was the project implemented? Did it go according to plan? Did something come up in the mix? If it did, what, how, and how did you address it? And finally, assessing project towards long-term outcomes. You're showing improved, in this case, in the shorter run, improved performance on implementing measures and then looking at whether or not there have been changes at the end of the year in terms of the outcome measures that are relevant to that year. In this case, it's how many are implementing project activities or to improve EDTC. In subsequent years, you'll be looking at improved metrics. Where were they on the measures, including the overall composite score, and then finally looking towards the latter part of the cycle at the errors and unnecessary emergency department or preventive admissions. So again, I think this is, in my mind, a useful and in the work that Bridget and I have done on this, and it reflects years of work with CAHs and state flex programs. It's a toolkit to assist the state flex coordinators in planning for, developing, and managing their flex projects. We're not doing this because we like to create more paperwork for you, but we have found, looking at numerous state flex state project applications over the year, outcome measurement, that there are some challenges, and we see that the tendency to focus on either output measures or high-level goals without thinking about how you navigate the interim years. And it offers a process that can be used across the funding cycle. Now, we have not, this is not a mandatory activity. We want to be clear about that, but we hope you'll find it useful. So within this, you will be able to find the toolkit with blank worksheets and a list of outcome measurement and management tools on our Flex Monitoring team website under resources and tools. And so if you have questions or you'd like some help with understanding how to use the toolkit, please reach out to either Bridget or me at the Flex Monitoring team at the University of Southern Maine. I've listed our emails and our phone numbers. We hope you found this helpful and look forward to hearing from you if you have any questions. Thank you.